This short video is one of a series that will provide you with training support on the SurePulse VS newborn heart rate monitor. This is the second of 4 videos and covers cap fitting and monitoring heart rate from birth.
Start the timer on the display unit touchscreen as soon as the baby is born. After the baby has been safely transferred to the mattress, wipe the baby's forehead clear of vernix. The sensor's position is shown by the mark on the outside of the cap. Place the sensor over the baby's right eyebrow on the forehead and secure the cap as shown. You are aiming for a cap tightness that is comfortable for the baby, tight enough to stop the cap from moving on the baby's head, but not so tight as to restrict blood flow. Observe the heart rate information on the display screen. If you do not see a trace after around 20 seconds, you may need to check the cap tightness and adjust it. If the cap is too loose or too tight, adjust as necessary or swap the cap for the appropriate size. If there is still no signal, check that the forehead under the sensor is clean and dry, that the module has not slipped under the baby or other equipment, and that there is no more than 3 meters between the module and the display unit. If there is disturbance to the cap, sensor or baby, the heart rate signal may be interrupted and the beats per minute on the display screen will change to grey, indicating the last confirmed heart rate. If there is an inadequate signal for longer than 5 seconds, the BPM will go blank. And when the signal is restored and stable, the trace and BPM will reappear in green. If you need to use CPAP, you may secure the apparatus to the cap using standard ribbon ties. There are also Velcro tabs and an additional strap should they be required. The cap is compatible with commonly used breathing apparatus. SurePulse VS will also record events and interventions. Once the timer has been started, press the Event button and a list of events will appear. A double click on Event can be used for a non-listed event. There is also a 6-second timer on the screen that appears as a red dot. This may help clinical staff estimate a heart rate using a stethoscope.
Thank you for watching this video. The next video in this series of 4 will provide you with training support for completing the session and managing data.